members, let us pray. Almighty God, we beseech you to behold with your pardon and favor blessings as your servants whom you please to call the leadership positions in this republic. We seek guidance to treat and consider all matters that shall come under deliberation in so just and faithful a manner as to advance the peace, prosperity, and welfare of our country and of those whose interest you have committed to our charge. Amen. So welcome, honorable members, for today's session, afternoon session, being the Wednesday, Tuesday, 5th March 2024. Clerk, you may read the order in the business paper.
Order number 1, administration of oath.
Next order.
Order number 2, communication from the chair.
Next order.
Order number 3, messages.
Next order.
Order number 4, petitions.
Next order.
Order number 5, papers.
Next order.
Order number 6, notices of motion.
Chair Health. You remove your notice of motion. The report, all right. Next order.
Order number 7, statements.
Honorable members, we have one statement by Honorable Dora Kano.
Thank you, Mr. Speaker, for giving me this opportunity. I want to seek a statement from the Health Committee. Pursuant to Section 9 of the County Government Act 2012 and Kericho County Assembly Standing Order number 41, Section 1, I wish to seek a statement from the relevant sectoral committee on the following concerns. How many health workers do we have in Kericho County? What is the status of the community of the health workers as launched during the Mashujaa Day celebration on 20th October 2023? What is the working framework for the community health promoters for Kericho County? How much money has been paid to each community health promoter? How much money has been spent so far in the Community Health Promoters Program? What plans has the Department of Health Services put in place in ensuring that the Community Health Promoters Program is sustainable? Thank you, Mr. Speaker.
Thank you. The statement raised goes to Committee on Health Services. Chairman, inform the House of the days you need to come up with a report for this statement.
Thank you, Chair. Thank you, Honorable Speaker, for giving me an opportunity just to report. Since the matter is very relevant to us and it is touching on community health workers, I seek for 2 weeks to come up with a report. Thank you, Chair.
All right, that is granted. So you have the time that you have stated to bring the report before this House. Now, Clerk, next order.
Order number 8, motion by the Chairman, Health Services Committee.
Chairman Health, you may move your motion.
Mr. Speaker, thank you for giving me an opportunity just to move the motion that the House adopt the report on Health Service Committee on the site visit to Londiani Sub-County Hospital. Mr. Speaker, sir, I think I'll move to the section, the background, and the checklist of what we came up with this report. Mr. Speaker, sir, we have some checklists. Start from the level of revenue automation as per the county, as per the governor directives, on ongoing cashless, level of automation on patient records, eye movement of patient, medical record from the registration, diagnosis, and pharmacy. Number 3, Mr. Speaker, discharge summary report schedule, payment disparities among the patient evening. In the checklist, Mr. Speaker, we have the drug stock level, the stocking schedule, and safety of the drugs. Number 4, Mr. Speaker, sub-county hospital service chartered and time taken to attend the patients. Access to the emergency cares as per the Kericho County Government Act, referral procedures during the medical emergencies, critical condition, standby ambulance, and call centers, Mr. Speaker. We also have staff level of the sub-county facilities, that is staff shortfall index, and the different levels of specialization. We also have level of role out of UHC and spread of community health volunteers. The bed capacity of the sub-county hospital, that is Londiani, and also, Mr. Speaker, we have the report from the patient, that is the opinion about the services being rendered by the hospital, if any, and if they meet the expectation of those patients. Here, of course, Mr. Speaker, we had also water supply, reliability to the sub-county hospital, and also, Mr. Speaker, level of cleanliness in the hospitals, that is checking on linen washings and sequences of changing of the same. Mr. Speaker, also the last one is the utilization of the NHIF facility by the sub-county hospitals and the prominence of the same. Mr. Speaker, we also checked on the challenges based on being experienced by the facility, of course, the Londiani sub-county hospital, and possible solution to address them. Mr. Speaker, sir, allow me to just give the findings, committee findings. When we visited the facility, Mr. Speaker, we were able to find out on the health services visited the various departments within the Londiani sub-county hospital and came up with the following findings. Mr. Speaker, the first place when you go to a facility, you check the casualty. So we started from the casualty, Mr. Speaker, and the committee noted that the casualty units had limited space to operate. That is, the infrastructure in the casualty unit did not meet the threshold of the casualty units. Of course, the casualty has some standard practices whereby when you look at our casualties in the guided by the Act, Health Service Act, Mr. Speaker, they have the Londiani lacked basic medical equipment. Of course, there are several medical equipment we found there, and the staff and the space. The area of operation is a modified reception. Mr. Speaker, the Londiani sub-county hospital casualty was previously used as an office, so it was modified to meet the requirements for the casualty. That was reception, and it was converted to emergency health cases, and it had only on the bed, one bed, and no equipment to attend the emergencies. Mr. Speaker, we checked on the clinic clerking units. There is a shortage of clinical officers in the outpatient unit. The total number is 6, and they have to stay to meet the patient requirement. They work for long hours, including weekends. 6 clinical officers, Mr. Speaker, were transferred to other facilities without replacement. That is what we found out, Mr. Speaker. And further, the information technology infrastructure supporting the healthcare provision and the patient's information is not steady. There is a total breakdown from the time to time as a result of weak internet, and the program used is the DOMAX. The system which is being used in Londiani is a system called DOMAX. Patients at the time forced to wait for long hours, and the time the clinical officer is forced to resort to manual process. Mr. Speaker, we also check on revenue and registration. The registration and the revenue collection is automated in the facility. If not for the weakness of the internet, the program in use, there is a seamless flow of patients' information right from the registration to the dispensing unit. Mr. Speaker, the system, which is DOMAX, is reported to be inefficient when upgrading of the software is not done on time. Nonetheless, Mr. Speaker, the revenue collection automated as per the governor's directive is via a pay bill number. And we checked the pay bill, it was the one which has been given directive by His Excellency the Governor. Mr. Speaker, sir, the staff manning registration and revenue are restrained since they are full and are forced to work for long hours, including the weekends. The space of operation is squeezed as per the patients crowd in the same room with the officer causing delay in registration. Mr. Speaker, it is also noted that when the system is down, it is hard to generate monthly report on revenues, collection, and the number of patients attended to. Mr. Speaker, allow me to also report on the pharmacy. The pharmacy unit has limited space for dispensing drugs and also had limited staff as well. The facility lacks an automated system to check on reorder level and to track the flow of drugs out of the drug store and inpatient dispensing unit. Mr. Speaker, the manual record of ordering the drugs necessary control mechanism as it provided for the prequisition section and not authorization fact, thus making it difficult to ascertain the flow of the drugs. The drug stock level is done manually once in a month, thus making it difficult to make reorder of crucial drugs within the facility. The information technology infrastructure aiding the pharmacy unit is not optimum, Mr. Speaker. However, it allows the clinical officer to check from his or her hand whether the drugs are in the store or not being prescribing. The pharmaceutical suppliers in the facility, Mr. Speaker, is well managed and it is in sufficient condition. The biggest challenge being protective cares as the support staff are using manual process to clean the dirty linen which poses health risk. Mr. Speaker, I also went to the laboratory unit, whereby in the laboratory unit, Mr. Speaker, the facility is modernized. It is ISO certified, and there is a seamless flow of patients, records, and information in the unit. The in charge of the laboratory section, Mr. Speaker, is well versed with the expectation of the unit and have supportive staff under him. The department has a service charter detailing the time taken for each sample taken to be processed, and whenever there are delays, prompt communication is given to patient explaining the cause of delays, even. And the same section, Mr. Speaker, the section conducts monthly samples, analysis, and generate reports to track and prevalence of various diseases. The power backup generator is in place to ensure that the samples are not contaminated and optimum temperature are not tampered with. Mr. Speaker, in the same laboratory department, the facility also has arrangement of samples and referral to dispatch. Of course, they are dispatching to Lancet and also Walter Reed and other hospitals for sample the process facility within the required cost-effective and frequency of the cases reported. Mr. Speaker, in the same laboratory department, the biggest challenges in this unit, Mr. Speaker, is the blood bank section, which needs serious policy intervention measures since it is guided by the national policy. Londiani, being an accident-prone areas, ought to have a blood bank, a section of its own, and the earlier the policy in place, the better, Mr. Speaker, which will be addressed, which will address the medical emergencies whenever it occurs. Mr. Speaker, the section also has a servicing agreement, the contract of equipment, which comes with a huge financial requirement. This is done quarterly. there is need to modernize the equipment being used, Mr. Speaker. Mr. Speaker, emergency and medical attention. The report, as per the the visitation, Mr. Speaker, the facility has arrangement where the patient are given emergency medical care, where they have money or not, whether they have money or not, on their baseline criteria set upon duly filed requisite document to warrant their cases. This is in line with Kericho County Health Act 2019, as has further the referral of to the Kericho County Referral Hospital and other facilities were eating the sub-county hospital budget, yet funds are pooled together for the same. The committee took it up upon itself to do further investigation on the same. Mr. Speaker, sir, move to NHIF section. The report on NHIF units in Londiani County Hospital is operating 24 hours and is efficient. The biggest challenge the facility is facing, Mr. Speaker, is the delays in remittance of the claims to the hospital. This results in straining of the limited resources to meet the immediate need as per the hospital await for reimbursement. Mr. Speaker, I'll move speedily on the electricity bills. The hospital also is connected to a direct hospital line, that is electricity. The hospital therefore forced to share the power supply with Londiani town, that is their neighborhood. The electricity overload often causes power outage, forcing the hospital to resort for the power backup generator, which is always costly. Mr. Speaker, the electricity bill normally have a range from 100,000 a month, which is quite expensive. An incident is reported of the hospital line being disconnected. This was quite risky for the health provision, as there are life support machines that are affected by the power outage. The committee noted that there is need to avail a direct line to the hospital so that it supports the same. The committee also, Mr. Speaker, the committee made the medical superintendent aware that the Committee on Budget and Appropriation had allocation of the same. It happens that we got time to discuss with the medical superintendent, and he has a report about the sub-county hospital, Mr. Speaker. The medical superintendent, Dr. Kipkoech Collins, took the committee through the process and the challenges the hospital has since faced. He gave an overview of the hospital and how how the past the staff were delivering on their duties despite myriads of challenges ranging from the staff shortage, Mr. Speaker, long working hours, lack of necessary equipment for efficient service delivery. He highlighted the need for a modern casualty units, since one is in use is a small one, and at times the patient has treated at the floor. Mr. Speaker, he made the committee aware that the hospital is operating on a projected budget of 600 million, where NHIF is the biggest revenue channel for the facility. He pointed out that delays in remittance of NHIF, Mr. Speaker, is one of the major challenges affecting the operation of the facility. He also noted the issue of waiver. The patient bill is eating into the financial ability of the hospital. There is a task and need for the reimbursement of the same through budgetary allocation. He made a request to the committee to modernize infrastructure in the hospital, like septic tank, removal of asbestos, roofing in the facility. He actually requested for the budgetary allocation to purchase the laundry machines, of which, Mr. Speaker, they are using a manual one to help in washing the hospital linen, and also modernizing the ICT infrastructure in the facility. He also pointed out that they source the medical supplies from KEMSA and meds, but at times KEMSA is non-responsive, thus making restocking of crucial drugs in the facility, Mr. Speaker. The facility has a reliable water supply from a power well, which is a solar powered, thus it is a big challenge. Mr. Speaker, we go to recommendation from the committee. One recommendation, Mr. Speaker, is that relying on all the challenges the facility is facing, from starting from the casualty, pharmacy, and what have you, Mr. Speaker, the committee recommended that the Department of Health Service to employ additional staffing across the county. Number two, Mr. Speaker, the hospital management should request the department to allocate funds to build a modern casualty and administration unit. Mr. Speaker, the hospital also should have an emergency and trauma unit since it's stretched in Londiani and it's an accident-prone area. Of course, we are aware of what happened the last 3 or 4 months, whereby Londiani is an area whereby it's prone to accident. Mr. Speaker, number 4 recommendation, the hospital should have a power backup generator, an independent power line from the KBLC, and of course, Mr. Speaker, solarization of the water plant in the facility is the key. Number 5, Mr. Speaker, the department should also allocate funds for expansion of the female and male ward to ease the congestion. Mr. Speaker, 6th recommendation, that the hospital should have an updated information system which will make services in the hospital efficient. Number 7, Mr. Speaker, the department to allocate funds for construction of a modern pharmacy unit with complete with drugstore and issuance center. And the lastly, Mr. Speaker, the Department of Health Services to purchase a linen, that is washing machine, to assist in the cleanliness. Mr. Speaker, I would like to acknowledge, so allow me to take this opportunity to thank all the members of the committee on health services for their invaluable input during deliberation and making service to visit Londiani Sub-County Hospital. Mr. Speaker, the Committee on Health Services also wish to thank your office and the clerk for logistical support, and I urge all these honorable members to support all the recommendation to assist the facility in the up and running of the activities, our daily activities, Mr. Speaker. So I want to request my member as Honorable Martin to second this motion, Mr. Speaker. Thank you.
Honorable Martin.
Thank you, Mr. Speaker, sir, for giving me this opportunity. I rise to second the report that has been tabled by the Honorable Chair, Honorable Eric B., on the oversight of Londiani Sub-County Hospital. Thank you, Mr. Speaker.
Thank you. So, honorable members, I now propose the question that this House adopts the report of the Health Services Committee on the oversight visit to Londiani Sub-County Hospital. The floor is now open for contribution. Honorable Martin, you cannot speak twice to a motion, so your chance is lost. Who else wants to contribute? So if there's none, I will give the, all right. Please, Honorable Irene Langat, very welcome. Maybe as you come, just remind Honorable Martin Chirio that once you have seconded by speaking, you don't get a second chance, but you only get a second chance when you bow and not speak. So you cannot speak twice to a motion. Honorable Irene Langat, you may continue.
So, thank you, Mr. Speaker, sir, for giving me this chance. So I rise to support this motion that has been put forward by the Chairman Health. I must congratulate the committee for coming up with this elaborate report. And I think everything has been captured as it is. Londiani Referral Hospital, as we speak, I think it handles so many cases, and it was prudent that a study or a research be conducted so that this committee comes up with their findings concerning the same hospital. We know that that area is prone to accidents, and those cases, the hospital handles cases that are a bit weighty. And from the challenges that we've looked at, the hospital is facing a lot of challenges, ranging from what we saw, the pharmacy, at the laboratory section, even the NHIF taking time to remit the said bills to the hospital. And what I want to talk about mainly is on NHIF and how the facility is training. If NHIF is not remitted in time, there is also this aspect of waiving. So you will find that this particular facility is training a lot. And from the recommendations we've seen, I think the Committee on Health made sound recommendations about this particular facility. It is upon our county and most of the Department of Health, together with the Committee of Health, to see to it that our hospitals are functioning well. The health of our people is the wealth of this nation. So if we don't look at these facilities, increase even their location to this health department, and then things are not going to work out the way it is supposed to be. So I just want to support this motion. Anything touching health, it is key in our county. So thank you so much, and thank you. I support.
Honorable Matthew Korir, then Honorable Vincent Korir. That order.
Thank you, Mr. Speaker, for giving me this opportunity. So that also I support the motion or the report tabled by the Chairman Health. Though, Mr. Speaker, I'm in a HATO committee where also we are looking into some issues that are affecting the health department. But nevertheless, Mr. Speaker, I want to thank the committee for coming up with this good report, though that we have a lot of challenges that health department are facing, Mr. Speaker. One being understaffing. In some cases, Mr. Speaker, it is very hard, even for one. When you go to Kericho Referral Hospital, for example, Mr. Speaker, one nurse manning 60 patients, Mr. Speaker, in a ward. And I think this report also, the way the chairman has stated, it is the true finding from the Londiani Sub-County Hospital, Mr. Speaker. Mr. Speaker, despite that we want also to, we are also discussing that we need to have some money in this department, Mr. Speaker. I think also that the Committee on Health should look into the issues, expenditures in all these in the whole department, Mr. Speaker. Mr. Speaker, we have an issue when it comes to issues drugs, Mr. Speaker, where the price of the local, Mr. Speaker, is high compared with the KEMSA and compared with the maids. So, Mr. Speaker, for the Committee on Health, I think you need to look into some issues going forward. After even we table the report on ADO committee, Mr. Speaker, the Committee on Health need also to look into the leadership of these facilities. Because, Mr. Speaker, at some level, there is a facility collecting a lot of money. Like now, Kapkatet, for example, Mr. Speaker, even that Londiani, I know since it is level 4, all the services provided in Londiani, the residents are paying for those services, Mr. Speaker. So, but at some point, you can go to a facility and you find out even the management or the leadership in that facility is very wanting, Mr. Speaker. So, Chairman L, I know this is a good report, but also when we table our report on ad hoc committee, I think also you'll combine with this report so that you can find out what is in the other facilities that you might not have tabled their report, Mr. Speaker, because we will try as much as possible to be very much objective, Mr. Speaker, so that when we submit a very good recommendation together with the Committee on Health, I think it will be implemented accordingly. Even it is our appeal that if it is possible, Mr. Speaker, although that we are facing challenges revenue, Mr. Speaker, I think we need to address the issue of our staffing in our facilities, Mr. Speaker, so that we'll be able even to give the service to the locals, Mr. Speaker. Mr. Speaker, let me wind there and say I support this report, and I know the chairman also will be able even to table the health facilities report. Like I can recommend, Mr. Speaker, a facility like Sociot, for example, Mr. Speaker, is still a health center, Mr. Speaker, but they are doing good. So, Mr. Speaker, with the chairman health, we are praying so hard that the moment that level, that health center, Mr. Speaker, will be upgraded to level 3, I think that is the time that the service delivered to the people of Sociot and Waldai and Belgut sub-county will be attended to. Thank you, Mr. Speaker, for that chance that you have given unto me.
Honorable Vincent Corey, and then Chair Health, Chair Finance.
Thank you very much, Mr. Speaker, for giving me this opportunity to interrogate and look at the report and also discuss about the report on Londiani Hospital. I would like to thank the committee for making a decision to visit this facility and again identify the challenges that are there at Londiani Hospital. Mr. Speaker, this is the hospital that I have known since my childhood when I was very young. And this is the hospital that is serving Kipkelion East, Kipkelion West sub-counties, and part of Nakuru County. Because some people from even Total and Molo areas still use the facility. Mr. Speaker, the issues raised here is normally being raised by the users. That is the people of Londiani, Kipkelion East, and other areas. And as their representatives, we normally receive complaints of the challenges that exist within the hospital. And again, the committee, I think, took enough time. They actually analyzed the challenges that are there, and I can confirm that these are the true challenges and the needs that the hospital required. And again, the improvements that need to be done. And if you can hear about what the people of Londiani and Kipkelion East have been asking for, a national referral hospital, is because maybe they have lost hope at some point that they are not getting the right services that are required from the health department. But this is a bold step from the committee. I would like to applaud the committee for what they did in regard to this. And I know this report will help bring solutions so that this hospital can be able to work like any other hospital around. I've seen their revenue and the targets is from FIF is close to 600 million. And I remember interacting with some of the management team from the hospital at some point. And they had these recommendations actually that the committee has tabled here. Mine is to continue. When you hear us, especially talking about the referral hospital in Londiani is very emotional at the moment. And the people of Kipkelion East and the Londiani area are yearning to have this facility for effective treatment and also emergencies that normally occur within that area. You have heard that there are a lot of accidents along that way. Recently, last year, we had an accident. Several years back, we had some accidents again that took away several lives from the people around and those people who passed through those roads. And again, if we get that dream of getting a referral hospitals, I know all these problems will be solved because major funding will come from the national government. But we will not throw away this hospital. What I'm requesting is for members to support all our sub-county hospitals, beginning with Londiani sub-county hospital, because most citizens are depending on this. Again, you see, when people are admitted at the hospital for some days, most of the people will come up saying the bill is too high. Meaning, we need to see how the money that is being raised from the people of the area, from the people who are being treated, is being utilized properly so that the facility will get the better services that are needed. When you look from the casualty, the report is actually saying it is not effective. Clerking unit and pharmacy, it is not enough. Again, the issue of drugs, because the sub-county hospital is being relied on by the other dispensaries and health facilities around, maybe for coordination, and sometimes when there are emergencies, this hospital is being dependent on by a large population. Imagine from Tendana Soget all the way to Chepseon, all the way to Kipkelion West, still believe that this is the hospital that is supporting the area. So I urge this house to actually to support this report and also push for implementation and for the recommendations of the committee to be implemented so that we can have better health facilities. Yesterday, in our area, we were commissioning 2 health facilities to actually support this hospital. And the major challenge is the staff and personnel, which I know in the next financial years, we can look for a way of even getting interns, the way we had suggested, that we can get even interns to help support these dispensaries. Most of the time, in our hospital, the main hospital and the dispensaries, you will find a long queue. I remember when I was campaigning, I got an injury, when I got an accident. And when I was taken to the hospital, my arm was broken. But I realized there were other people who are more injured than me. And they were still queuing, waiting for the personnel to come and attend to them. Where you need to make a lot of calls, you need to call around, make a lot of noises, so that you can be treated. We don't want to see such a situation where you have to shout, you have to call people, so that you can be attended. Because life is so precious to everyone. Again, there's a time when we used to have critical emergencies where someone has to be rushed to Kericho Referral Hospital. And there used to be a challenge of an ambulance where the hospital used to demand for money in advance because of fuel. But I think I've seen in the report that it has been addressed, which I do congratulate the management for doing that. I also still will not forget to congratulate the team in that hospital when the accident occurred. They really tried their best to save a lot of lives. Actually, with those the poor facilities, they actually managed to save some of the people who were injured during the accidents. Otherwise, Mr. Speaker, sir, I would like to say this committee did a lot of good work. And again, maybe we should follow up to actually be monitoring that hospital and other sub-county hospitals and our dispensaries so that we get better services for our people. Thank you, Mr. Speaker.
Honorable Kibet Basuben, then Chief Whip will finalize on that section.
Thank you, Mr. Speaker, sir, for giving me this opportunity to support this report on oversight visit to Londiani Sub-County Hospital. And first and foremost, I would like to congratulate the committee on health services being chaired by our honorable member, Eric Peth, who is a medic. I remember one time we did an oversight. I'm not a member to Committee on Health Services, but we went to Kapadet Hospital on oversight roles. And I was glad that these people we have in this county assembly are being chaired by Honorable Eric P., Moses Rotich, and Dr. Moritim. They did a very wonderful work. And today, even I'm witnessing in this report being tabled by my good friend, Honorable Eric P., but coming, and I want to support this message from Medsup Londiani, Dr. Kipkoech Collins, where at some point he pointed out that we have a lot of challenges in the hospital matters financial due to some honorable members asking for waiver, which is sitting to the finance department in the hospital. He requested that we need to reimburse to the same through budgetary allocation. And I remember one time when we were doing our budget committee, we asked ourselves, where are we getting funds to reimburse on this waiver? Most of us, and me being the chair of finance, we have had a lot of challenges. That's why even the revenue collection through FIF is so low, simply because most of us are the members of county assembly are calling these medsups, are calling the administrators to waive bills for the patients. So we have two things. It's either we put money on our budget, or we even advise our people to get their NHIF. We do public barazas, and we advise our people to get their NHIF so that they can ease when they are paying hospital bills. And this will help so much even getting drugs. Number two, Mr. Speaker, sir, is the recommendations. Not number one, where the committee recommended that they need to employ additional health staffing. And of course, we appropriated some funds. Hopefully, we will, we believe that very soon they will implement to rescue our facilities. That notwithstanding, Mr. Speaker, sir, those people who are employed in those facilities should do their work properly. Otherwise, I support this motion, and I would like to congratulate the team for doing such a very wonderful work. Thank you so much, Mr. Speaker.
Thank you so much. I think at this juncture, I'd like to give the mover of the motion to reply.
Thank you very much, Mr. Speaker, for the overwhelming support given by members by supporting this report. Mr. Speaker, I must say that we are moving on. We've started from Londiani, we are headed to other sub-counties so that we come up with all these good reports. And for the good members who've actually stood with us by supporting it, I must say thank you. And the only thing we request is after this implementation, after this approval, we are requesting the implementation part of it to be done in a quick manner, Mr. Speaker, so that we get the fruit of this oversight. Otherwise, thank you very much for giving me an opportunity, members, to support. Thank you.
So, honorable members, I now rise to put the question that this House approves the report of the Health Services Committee on the oversight visit to Londiani Sub-County Hospital. Will as many of similar opinion say aye? And will as many of the contrary opinion say nay? The ayes have it. So, honorable members, there being no other business, this assembly stands adjourned until tomorrow, Wednesday, at 9:30 a.m. Thank you.